Now, the next big aspect of neonatal jaundice that we get to discuss is um, if you have a baby having jaundice pop up in the clinic, what are the various important questions that will ask that will help you around confirming the jaundice? Okay, knowing how far it has affected the baby, knowing how long it has affected the baby. Okay, and it will also help you in the types of treatment you are bringing in. So this is history taking, medical history taking for neonatal jaundice. Okay, so history taking for neonatal jaundice is very important. It will help you. Lots I was talking about the importance. It will help you know what caused it. It will help you know how far it has affected that baby, how long it has affected that baby. Then it will help you know how to go about the treatment, which is very important. So things that you should ask, okay, and you shouldn't miss is you should try to know when that jaundice started. So is it early or late? Is it within the first 24 hours? Is it within the first week, or is it after the first week? You look at the gestational age that the baby was born. Is the baby premature or term? You look at the birth weight, look at the mode of delivery, then you take out the Apgar score and all of that. You can also try to inquire about the Apgar score when the baby was born. Okay, then you can also do Apgar score is when the baby was born, funny enough, right? So you try to inquire about that. Did the baby cry immediately? Do you understand? Did they beat the baby? And so you ask all those questions. Place of birth: was the baby born at home or in a hospital, and which hospital? So depending on where you are staying, you know whether the hospital is a good one or not. So feeding history. Okay, have you been feeding the baby only breast milk, or you have been mixing up? How frequent do you feed the baby? Weight changes since birth. Is it the baby losing weight or gaining? Okay, then you pick out for signs of dehydration like dry lips and all of that. So for the stool and urine output, look at the color of stool, look at the frequency of urination. And if it's dark urine, you can be suspecting for conjugated hyperbilirubinemia. So maternal history now, look at blood grouping of the mother and the rhesus status to rule out hemolytic disease of the newborn, right? Then you get to ask if there were infections during pregnancy. Okay, you look at the different drugs that the mother was taking, or does the mother abuse alcohol or smoke? Okay, then you look at if the mother has an underlying diabetes, thyroid disorder, autoimmune condition. Okay, so family history, you ask if there's been any jaundice in anybody, either small or big. If the mother has given birth to other siblings, you ask if the other children has ever had a similar condition. You also ask if they have any other blood related disease, liver disease and all of them. Then you pick up the clinical signs like poor feeding, the baby is crying, the baby is vomiting, they have fever, seizures, that's a kernicterus. You do palpation for the spleen, okay, the liver and all of that. So treatments, you can do phototherapies, you can also measure this one I'm trying to do, ask about, since this condition started for the baby, what treatment has this baby received? In Africa, you ask them if they have taken them to traditional homes and all of that. Okay, you do blood grouping, you do bilirubin levels and the rest of them. Okay, so by and large, for history taken as related to neonatal jaundice, these are the things you shouldn't miss out.